So we have ample of evidence now that in a disease like heart failure, which has a very poor prognosis, very costly disease to have, and kills the patient at a young age in India and causes a lot of economic and social burden on India, ARNI is a life-saving drug. ARNI in the Paradigm Heart Failure trial has been shown to reduce the cardiovascular deaths. It has been shown to reduce the heart failure hospitalization. So if you want to put it in a simpler way, it keeps your patient alive longer, it keeps your patient out of the hospital, and it keeps the patient happy by improving his quality of life. So for all your even apparently stable heart failure patient, there is no stable heart failure patient in heart failure. The stable heart failure patient is a myth. ARNI is a drug which is deserved by even the stable heart failure patient to prevent his journey towards his death and prevent heart failure hospitalization. And the heart failure hospitalization, they are a big event in the life of the heart failure patient. ARNIs are a must drug to be started within the hospital itself at discharge, because the patient may not come back for a follow-up, because the post heart failure discharge period, like there is a golden hour in the MI patient, there is a golden month you can say in the heart failure patient. The period after the discharge is a very important period for the heart failure patient. This is a golden month and the ARNI should not be missed in this period. Whether you can up titrate the dose or not, yes, you can easily start the ARNI within the hospital. You can go up like any other therapy which is started within the hospital. If you are starting the ARNI after the hospital, then there is a benefit in starting the ARNI within the hospital, because the outcomes are better if you start within the hospital. So there is no reason to fear starting the ARNI within the hospital. You should start within the hospital. Do not miss the time period of the golden month, and you can derive rich benefits in the ejection fraction, in the survival of the patient, and the NT-proBNP. And lastly, coming to the heart failure with preserved ejection fraction, ARNI therapy can now be extended to the heart failure with preserved ejection fraction patient as well. There is guideline support as well as there is evidence from a large number of trials like Paragon heart failure trial that even the 4 pillars of heart failure therapy can now be extended to the heart failure with preserved ejection fraction patients as well. Thank you so much for your patient listening.